Welcome back to week 2. This is module 4, and it is part 2 of strategic initiatives for health information technology systems. So we're going to continue on. We have the same 8 learning objectives. IT strategy has more importance in healthcare than in other industries or areas. And one of the reasons why it's more important is because this involves things like patient safety. Um, there's a lot of changing funding requirements in healthcare right now. And so some industries, IT can be a nice to have, but in the healthcare industry, we really can't have healthcare right now without having IT for things like revenue systems, clinical systems, and electronic medical records. Accountability for care. Purchasers of care, both the payers, so insurance companies, and patients, are becoming more interested in understanding the costs involved and the quality of care. Interoperable electronic health records. The adoption of these EHRs or EMRs is expected to have machine learning, artificial intelligence, and natural language processing in coming years, with more interfacing to and from patients and consumers. And data is now considered a critical organizational asset in the same way organizations have assets such as buildings, furniture, products, and money in the bank. Implementations for health IT can be complex and expensive. There is now a higher bar for IT execution, even though we are hearing from chief information officers that many health systems are not yet achieving this higher bar, and they're actually settling for less, which is not a good thing to hear. Major applications such as the EHR or EMR are very difficult to implement. These initiatives are at risk of being over budget, taking longer than planned, and delivering results that don't match the description in the brochure. Many organizations have just resigned themselves to mediocre execution and results, but this is something that we're going to see change as health systems need to be more accountable to failed implementations. As systems become more critical strategically, tolerance for suboptimal execution becomes much lower. The strategic stakes are high, and any initiative that fails to deliver what was originally intended does have consequences that are now much more serious. A tightening of capital availability means that organizations are able to fund fewer IT initiatives. So those projects that are funded had better deliver the goods. So virtual care, which means caring from a remote location, is no longer optional. Telehealth has morphed into a powerful resource that enables the disruption of healthcare delivery. And it's interesting because maybe about 4 or 5 years ago, there were a lot of naysayers in health systems that were laughing at something like this. And, those health systems that didn't get on board early are now behind the 8 ball. As enterprise approach maximizes resources, creates more efficient operations, consolidates workforce, and enables scale, and leadership support from this chief executive officer and physician champions are essential to achieve success with IT projects. To circumvent reimbursement issues, virtual care leaders often initiate value-based contracts, secure grants, and develop other creative payment solutions and offer free services. Hospital operating income falls for 2/3 of health systems. So this is from a recent news article in 2018, fourth quarter. Hospital expenses are rising faster than revenue growth for health systems, resulting in declining operating income. Rapidly growing hospital expenses are now the primary driver of declining operating margins. Demand went down for key hospital services like surgery and inpatient admissions. Policymakers and healthcare leaders are particularly looking to decrease the number of hospital admissions and safely shift inpatient surgeries to less expensive outpatient settings. In addition to shifting the actual surveys to outpatient settings, we're seeing many health systems shift recovery to nearby hotels and apartments. While hospital revenue growth slowed, hospital expenses sharply rose as healthcare organizations invested in new technologies. Value-based reimbursement, federal requirements, and other components of the Affordable Care Act prompted hospitals to make strategic investments in electronic health records, physicians, and population health management, causing expenses to increase. So this chart, this bar graph, is from HIMSS Analytics. It was a 2015 survey of healthcare executives, the top population health strategies, and the percentage of respondents using these approaches. So at the time, 83% focused on chronic disease management, 82% on general preventative care, and 70% on workplace wellness programs. And this still holds true now in 2019. Health system strategic plans. So these are some examples, and you can actually go out there on the internet and you can find high-level strategic plans from many health systems across the country. This is from UC Davis, and there are 6 items here, or 6 strategic initiatives. Lead, person-centered care in the best way, at the best time, in the best place, and with the best team. 2, reimagine education by cultivating diverse, transdisciplinary, lifelong learners who will lead transformation in healthcare to advance well-being and equity for all. Number 3, accelerate innovative research to improve lives and reduce the burden of disease through discovery, implementation, and dissemination of new knowledge. 4, improve population health through the use of big data and precision health. 5, transform our culture by engaging everyone with compassion and inclusion, by inspiring innovative ideas, and by empowering each other. And 6, promote sustainability through shared goals, balanced priorities, and investments in our workforce and in our community. This sounds wonderful, doesn't it? And as I take you through a couple other examples, you're going to find that many sound very familiar. Having been involved in these talks at some health systems, many times, believe it or not, people put these words down on paper. They may copy them from other health systems, but actually putting these strategic initiatives into practice is a whole lot more challenging than just putting these buzzwords down on paper. Here's an example from Johns Hopkins. I do like the way that they present this as people, biomedical discovery, patient and family-centered care, education, integration, and performance. Penn State Health, achieve the highest value of quality, safety, and value. Educate and invest in creating a diverse and inclusive workforce that strives for personal and professional success. Create an extraordinary patient experience. Create innovation through research. And develop and differentiate our regional integrated academic healthcare system. And then we have community and health system strategic plans. The 2020 vision for North Broad is to create a health zone around Temple Health. This plan was released by a nonprofit, North Broad Renaissance, which is dedicated to connecting community members with political and other local leaders in an effort to revitalize the economy and quality of life along Philadelphia's North Broad corridor. So this is a great example of, really looking at not just sick people in a hospital, but also where people live, work, and play, and coming together to create an overarching plan that not only helps people after they become sick or injured, but also looks at public health, population health, prevention, and overall well-being for all of the social determinants of health. And so some major initiatives under this plan: nurse navigation. So having nurses help patients navigate through the challenging healthcare environment. Community health workers that are out there in the community at places of worship, at community centers, in patients' homes, wellness programs, and chronic disease management, the Skilled Nursing Home Collaborative, a transition of care program, and a drug utilization program. So, in summary, IT strategy must be done. We can no longer do what was happening even 5 years ago, where somebody said, oh, I want to purchase this software, or I want to purchase and buy a new scheduling system. Because what ends up happening is that across the health system, there isn't just one enterprise scheduling system. There are 4 or 5. And so we're really moving away from everybody just winging it and going to a conference and seeing these bright and shiny objects and saying, I want this, I have money, let's go buy this. There has to be a purpose, there has to be a vision, a mission, and goals, and the IT strategy has to align with the strategic direction of the organization. Many times that strategy is a collaboration. If it's an academic health system, it will be between the College of Medicine or the university and the hospital. And if it's a community hospital, it may also include other functions within the health system or the community. Execution is critical. No more tolerance for sloppy or poor IT implementations. IT projects are carefully chosen, vetted, funded, governed, and measured for outcomes and impact. HIT must align with business strategy. Business leaders are making the decisions. The role of the Chief Information Officer is weaker now, and stakeholders must be involved in strategy, and this includes the community, patients, employees, visitors, really everybody. So for next week, you may proceed to week 3, module 5, after completing the week 2 Canvas assignments. Thank you.